When red cells are normal in size, the question becomes whether the bone marrow is responding appropriately to the anemia. The reticulocyte count answers this. Reticulocytes are immature red cells released from the marrow. A healthy marrow facing anemia should ramp up production within several days, raising the reticulocyte count substantially. For accuracy, the count should be corrected for the degree of anemia using the reticulocyte production index, because a seemingly normal percentage in an anemic patient actually represents inadequate output. A high reticulocyte count indicates the marrow is working hard, but red cells are being destroyed or lost faster than they can be replaced. The two principal mechanisms are hemolytic anemia and acute blood loss. Hemolysis can be intravascular, occurring within the vessels and producing schistocytes, hemoglobinuria, low haptoglobin, and elevated lactate dehydrogenase. It can also be extravascular, occurring within the spleen and liver and producing spherocytes and indurent hyperbilirubinemia. The causes of hemolysis are vast. Autoimmune hemolytic anemia include warm and cold agglutinin types, hereditary membrane defects such as hereditary spherocytosis and elliptocytosis, enzymopathies including G6PD deficiency and pyruvate kinase deficiency, hemoglobinopathies such as sickle cell disease, microangiopathic processes like TTP, HUS, and DIC, mechanical destruction from prosthetic valves, and infections including malaria, babesia, and Clostridium. A low reticulocyte count in normocytic anemia signals that the marrow is failing to produce adequately. It cannot keep up with even baseline red cell turnover. Aplastic anemia is a marrow failure state where pluripotent stem cells are destroyed, often through immune-mediated mechanisms, sometimes idiopathic, sometimes post-viral or drug-induced. It produces pancytopenia with a hypocellular fatty marrow on biopsy. Chronic kidney disease causes anemia primarily through reduced production of erythropoietin by the peritubular fibroblasts of the kidney. Without this hormonal drive, the marrow simply does not receive the signal to produce red cells, and treatment relies on erythropoiesis-stimulating agents, ESA. Bone marrow suppression or infiltration captures conditions where the marrow space is either toxically suppressed by chemotherapy, radiation, or certain drugs, or physically replaced by leukemia, lymphoma, metastatic carcinoma, myelofibrosis, or granulomatous disease. The peripheral smear may show a leukoerythroblastic picture with teardrop cells and immature precursors. Early iron deficiency is a useful pearl to remember. Before iron deficiency produces frankly small cells, it passes through a normocytic phase. So in normocytic anemia with low ferritin is still iron deficiency in evolution.